And this is for those of y'all that have been prescribed vaginal estrogen and don't know how to use it. You don't know what to do with this. This is the video that I'm making. And if you've been prescribed vaginal estrogen by anybody, you probably weren't given a good rundown of like actually how to use it. Maybe you were, but you're still confused. This is the video for you. You want to keep watching, okay? Hey YouTube fan, it's your girl, Dr. Fenwa Milhouse, aka your favorite urologist, aka Dr. Down Below. And I've got a video that has been long in the making. Okay, so as you may or may not know, I own my own practice called Down There Urology in Chicago. And one really great, unique part of this practice that I own alongside with my partner, Dr. Juggin Consol, is that we together are a one-stop shop for any adult individual who's dealing with a genital or sexual issue. Doesn't matter what's between your leg, vulva, penis, whatever. Doesn't matter your gender identity or preference. We treat all of it. And that is actually quite unique for one spot to be able to handle all of it, okay, in one area. A lot of times you have to go to maybe a urologist for man stuff and, you know, another specialty, gynecologist or other for female stuff. You guys know what I'm talking about. My practice, I can do it all. I personally treat both vulva owners and penis owners. And one very common thing that is a part of my practice is utilizing vaginal estrogen for my vulva owners. That's what this whole long segue has been. It's not been a plug for my practice. It's actually the segue to this video. And this is for those of y'all that have been prescribed vaginal estrogen and don't know how to use it. You don't know what to do with this. This is the video that I'm making. And if you've been prescribed vaginal estrogen by anybody, you probably weren't given a good rundown of like actually how to use it. Maybe you were, but you're still confused. This is the video for you. You want to keep watching, okay? So to catch you up to speed, vaginal estradiol cream or vaginal estrogen is commonly used to treat the symptoms of genitourinary syndrome of menopause or any estrogen deficiency. Symptoms like vaginal dryness, vaginal itching, recurrent UTIs, even urgency, urethral burning, vulva burning, all of that, okay? And the most common formulation that is used is vaginal estradiol cream, tube that looks like this. This is my own cream because I use it for my vulva. That's why it looks pretty used, okay? And a lot of times we're busy doctors and we prescribe this out, but we don't take the time to like actually go into the minutia details on actually how the patient's supposed to use it. And I will say more often than not, patients get this and don't know what to do exactly. And then that is a common reason why patients stop using it. They kind of, or they use it wrong and they're not getting it where it needs to, and it's then not working, and then patients give up, all these things. So this is an important video to show you all how to properly use it. And I will say, caveat, you may be given very specific instructions by your physician, and that trumps anything that I'm saying in this video. How I'm about to explain it is the way that I have counseled my patients on how to use it specifically, and it is used as a guide if you're not given any specific instructions by your provider or prescriber, okay? So vaginal estradiol cream comes with the tube and this plastic applicator, okay? Plastic applicator comes with it. It's only one plastic applicator per box, so this is meant to be reusable. It's not meant to be you use one time, all right? Oftentimes, the dose of the prescription is 1 gram 3 times per week, okay? Again, you may be given other instructions. Please follow your prescriber's instructions, but the common dose is 1 gram 3 times a week. How do you know how to give yourself 1 gram 3 times a week? Well, there are a couple different ways that you can do it. One way is to use this plastic applicator. This plastic applicator has this end and this end, okay? And you can see the 1 gram, 2 gram, 3 grams. Okay, so you take your tube of vaginal estradiol cream, you uncap it, okay? Uncap it, and then you screw it, the end that is tapered, if you will, and it actually is meant to kind of screw onto your tube, okay? Just like this, all right? And then you push from the bottom, you push the tube until you get to the 1. And you see how it's risen now? Like I'm pushing from below. You can see cream in here. And if I can show you, again, this has been used. But yeah, you see that? Bam. Okay, so if you're at 1 gram, the most common dose, you want to get it right there. That's the 1 gram line. I hope you all see that, okay? And so then you would screw it off. And what you'll find is you've got 1 gram of vaginal estradiol in your applicator. And then you would gently insert this in the introitus of your vagina. Okay, so you want to spread the lips, right? You're getting it inside the vagina. This is my vulva model. And the red is the vaginal introitus. And you would gently insert it inside. And I always get asked, like, how far do I go? It does not need to go all the way up by the apex of the vagina or the cervix. I generally tell patients, put it in so that this amount is in, I would say, but it doesn't have to go deep, okay? It doesn't have to be too deep. And then you would dispense it by pushing this in. Now, I'm not going to do that because I don't want to get a bunch of cream in my nice vulva pillow. But you guys get the picture. You would dispense this by just pushing that in. I think some of it actually went in already on accident. But anyway, and so you'll get cream in the vagina. See, I didn't even mean to do this, but it happened, okay? Now, common thing is this is messy. The next morning, it still feels like creamy. Somebody told me this. Think of it like sunscreen on your face. You don't just blop sunscreen on your face and then leave it there. You rub it in. So likewise, take your finger in your vagina and rub it in, okay? Rub that cream in. Rub it in so that it gets into the walls and it's not just this chunk of cream that's just sitting there overnight. This is done at night. That's why I keep saying overnight, okay? All right? And now look, like sunscreen, it's like gotten into the walls, okay? That's how you want to do it. It's not just plop the cream in, all right? Now, that is one way. By the way, if you do use the applicator and want a good way to clean in between the crevices, a patient taught me that they use a straw brush. So you can get like a straw brush that you can buy easily, and you can use that to clean it, you know, so that you can have it fresh every night, all right? Does not need to be sterile, you guys. This is not a sterile application. This is a clean application, but not sterile, okay? So another way is 1 gram is roughly 2 finger joints, if you will. Okay, 2 segments on your finger. This is half a gram from here to here, and this is 1 gram. So one other way you can do it is you can just, almost like your finger is a toothbrush, bam, that's roughly 1 gram. And you put that on your fingertip, and you can put that in your vagina, right? And rub it in. And again, like this, like sunscreen, you're going to put that in and rub it in. Rub, 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 rub. Nice. Okay. Now, the way that I oftentimes will counsel my own patients, because I typically want patients to have some vaginal estrogen, not only inside the vagina, but at and around the opening in this part of the vulva called the vestibule. The vestibule is the part of the vulva that is in between the inner lips. Okay, let's just remind ourselves. These are the outer lips, okay? Labia majora, these are the inner lips, okay? Our inner lips can be very variable. If you spread both the outer and inner lips, there's this air. This is a clitoral hood, okay? This hood is really hooding. But if you spread the inner and outer lips, all of this in between is the vestibule. And oftentimes I'll want my patients to use some of the cream there, okay, to get it around vaginal opening and include the urethral opening too. That's the urethral opening, all right, especially if I'm prescribing this for a patient who has recurrent UTIs or has vulva like pain or itching or something like that. So what I'll have them actually do is use half a gram inside and half a gram outside. And I essentially tell them to use their finger. And again, because we know this is half a gram, right? When we did a gram, it was 2, but this is half a gram. I tell them to use and put it on their fingertip, spread, and put it all in here, okay? All in here. Half a gram is going all in this vestibule, introitus, urethral opening area, okay? Then they'll use the other 1/2 gram, they'll do another 1/2 gram and put it inside, okay? And rub that in, rub that in, rub that in, okay? All right? If they still want to use the applicator for the intravaginal or inside portion, they can. They would just, instead of pushing the whole part that's filled to 1 gram, they would push, they can put 1/2 of it in, and then they can put the other 1/2 on their finger. And that can be the part that they used for the vestibule part, okay? So hopefully that helped a lot of you all. And if you're a patient of mine and I referred you here, like, tell me what you think next time you see me in follow-up. So that is how you use vaginal estradiol cream. I strongly recommend being consistent with it. There are many advantages and it is extremely safe to use and really helps a lot of us dealing with these common, very, very common changes that happen in our vulva and our vagina and these symptoms that we do not have to suffer from, okay? Let me know what you think in the comments below. I'd love to hear it. Please like this video. Please share it widely, okay? I really am motivated to make videos like this to help individuals. It is not a personal plug or, self-promoting, really to help people. So let me know what you think. Make sure you subscribe so you can join me for more things down there right